Giovanni, it is a pleasure to be sitting with you again. You're a medical doctor, a scientist in AI, and an academic. What is it that drove your passion in these three areas?
Well, thank you for having me. When I was a medical student, I noticed there was a gap between our studies and how we thought we could treat patients and the reality. The work became harder than what I thought it would be, and I figured that some kind of AI system could better help us into the way we do our job and be better at doing it.
And now that you are on the ground, you're doing the work, what is the impact that you're seeing of AI both on physicians and the healthcare system?
When we consider AI, we consider large systems that can tackle specific tasks in the healthcare environment. Well, my top three are the following. The first one is that we try to adopt AI to improve how patients are cared for and citizens get into a better health status when we treat them using AI system. And this is a first objective. A second part is enabling physicians to perform better, to augment their competencies and their skills, but also to be better at work, live a better life when they are at work. And this is a crucial point because we often do not care for the healthcare professionals. A third point is supporting healthcare institutions. They can strive and they can do better if we give them proper data-enabled tools and better manage what happens within the hospitals, patient flows and data flows and physicians flows and other healthcare professionals.
What about the patient?
Well, this is a very interesting question. We have often talked in the past 20 years of the 4P model of medicine, but AI is really doing that with AI tools such as app that automatically ask questions, ecological momentary assessment, and other similar technologies. Patients are gaining autonomy and they are really becoming protagonists into their way of being treated of. And we are slowly moving from a sick care system to a really healthcare system. And this is a really interesting part. So yeah, autonomy and a real patient-driven kind of care. So this is how AI is doing it.
I could see the sparkle in your eye when you talk about the patient. What are you seeing in terms of concrete things that are happening in the field right now that you're excited about?
I'm really excited about the administrative part of healthcare technologies. That is, those technologies that can take care of routine process with low added value that can help healthcare professionals focus on the patient. These are the first thing I'm excited about. Second thing are all those technologies that can help us better predict, diagnose, and treat patients. Those are slowly coming into routine clinical practice through clinical studies first, because we need to prove both to ourselves, to the company, to the hospital, and to the government that our technology is really meaningful. But afterwards, after the studies are published, the process stays on and we can really see that technologies are being adopted into clinical practice. And this is a reality today.
I love that. Prediction, prevention, and early diagnosis, as well as helping patients and people stay healthier longer. So looking into the future, looking into our crystal ball, next 10 years, what is your hope? What is your hope for the impact of AI on healthcare and patients?
My hope and my goal also is to provide a cultural change where we can enable each unit, each department in every hospital, in every general practice house, that we can push them into adopting their very first AI project in the next 10 years. Because when projects come from the very teams that will adopt them, those are the projects that are most successful. And adopting the same mindset that we have with big hospitals or big university staff that adopt one clinical AI project and then it gets settled into clinical practice, the same has to be done with every hospital and every department.
I love that, Giovanni. A pilot in every unit in every hospital. That would certainly be a vision we could both get behind. Thank you so much for the opportunity to have this conversation. So insightful. Thank you.
Thank you for having me.